Bittman for Edible Education 101, and I'm here with Dr. Daphne Miller, who is a practicing physician, which means she actually sees patients, and on the faculty at University of California, San Francisco. I should add a friend of mine. Hi.
Hi,
Good
thanks
to
so
have
much
you
for
here.
having me.
Your book, Farmacology, one of your books, Farmacology, looks at the link between agriculture, medicine, human health, food, and so on. Let's talk about where the connections and the disconnections are among those things.
Well, it was actually the end of a long exploration for me to come to writing about agriculture, because it's not the obvious place for a physician to go when they're thinking about human health. And in fact, I had spent years beforehand just writing about nutrition and nutrients, and at the outer edge of my exploration was whole foods, and wrote a whole book about it, did a lot of teaching and research around the connections between whole foods and health.
Whole foods as in real food, not Whole Foods as in supermarkets.
And not as in supermarket,
Right.
but as in, thinking about broccoli and cauliflower versus, just thinking about iron and fiber, which is really where most of healthcare stops when they think about nutrition. But I started to suddenly realize that I had made a terrible error in stopping at just thinking about food, and that there was this whole system that was underpinning the food and that absolutely predicted the quality of that food. And I knew nothing about that system. All broccoli is not created equal, as we know. And in fact, the way it is grown and the whole system that supports that has everything to do with our health, not just in terms of the nutrients in that food, but also the ecosystem that grew that food has everything to do with our health.
So when you say all broccoli is not created equal, what are the differences among types of broccoli? Or what are the qualities that make broccoli better or worse?
Well, I mean, you could start wherever you want along sort of the food chain or in sort of the series of decisions that are made. But let's start with seed and the choice of what kind of broccoli to grow. Is it some heritage variety that is actually much richer in nutrients and better suited for a certain ecosystem versus something that is just much more of a hybridized, high sugar content broccoli? That's just one example. But the actual farming system, so the way the soil is treated, where that broccoli is grown, has everything to do with our health. Maybe not in such a direct fashion as what ends up on our plate, but the way that the soil is treated, how much of that soil is actually aerosolized into the air, how many microbes are nurtured in the soil, so the biodiversity of the soil, how many other companion plants are on that farm, so the biodiversity of the farm. All of those things we're learning have everything to do with human health. And yet, within medicine, we don't think of those factors when we think about nutrition.
We think about nutrition as what is the nutritional content of this food?
Yeah, and that's already very advanced thinking for medicine, honestly. Usually we think about nutrition in terms of just breaking things down into vitamins and supplements. I mean, when I was in medical school, the one day of nutrition that I had was how to hang a total parenteral nutrition bag for someone who was in the ICU, So and that's very extreme, but it kind of gets at the way we think about nutrition in medicine, in that it is seriously like a bag of supplements, So even to think about whole foods, and I'm not talking about the supermarket, about foods that are unprocessed, is advanced thinking for medicine. And to go beyond that and think of the whole context or ecosystem in which those foods were grown is really virtually not done from a medical perspective.
Well, let's start with the end. Let's start with the food. What's taught and what should be taught around eating in medical school?
Well, nothing is taught. So I guess we can talk about what should be taught.
Yeah.
I mean, there are electives. Various medical schools do have certain electives where you can do, an elective in nutrition. I've certainly heard that happening. Here at UCSF, I give a talk in the Osher Center, which is a Center for Integrative Medicine, about whole food, and I'm certain that there probably are a couple nutrition lectures within the core curriculum for the medical students. There's certainly talks now about obesity and sort of the foods that are connected to obesity, because that's considered sort of a medicalization of food. Sort of how do you use food to reverse obesity? But what I call our eating ecosystem is really not addressed at all. So all the things that actually contribute to our experience of eating, from everything from how food is displayed in the communities where we live, which has everything to do with how we can access food. Does it come from fast food? Does it come, is it in farmers markets? Is it accessible in our schools? What kind of food is accessible in our schools? What does eating in the context of our family and our home life mean? All of these things that have everything to do with our health are actually not discussed and not taught. And certainly not, food as it is supplied to us through agriculture.
Where do people, or where might people learn how to eat well? I mean, they're not. You're saying doctors are essentially incapable of teaching that lesson. They're
Well, I
not
think that
learning
there are
enough
some
to be able
engaged physicians, and I'm hearing more and more examples of that. I was just at Stone Barns this weekend in New York and met a doctor who's given up his practice in New Jersey and is now seeing patients on his farm, which I thought was a very interesting, although pretty rarefied model. But I think that where we're starting to see changes are very exciting places like schools that are embracing edible education and are teaching, have schoolyards where they're actually teaching kids where food comes from the soil up, and then are teaching children how to cook, because in fact learning how to work with these whole foods or these raw ingredients is probably one of the most important things. I mean, we're seeing it in the context of families that are given more access to fresh food boxes and community gardens, and can use their WIC dollars there rather than just in buying fast food in the supermarket.
Is there an evolution that's happening where people are beginning to understand that, let's say, all calories are not created equal? That some food is of higher quality than other food and affects us differently?
I think that there is a cultural shift going on, for sure, toward a healthier way of eating, and that I have been across this country talking to farmers and talking to communities, and really in very unexpected places. I'm seeing slow food chapters, community meals, local gardens. I was just in Iowa, and there's a whole network of free gardens that they run there in Grinnell, Iowa. So I think that there is a very exciting shift happening across this country. It's kind of what I call the alternative universe of eating, because it certainly goes against all the messages that you get from processed food and processed companies that push processed foods.
Where and how is that message best propagated, that there is an alternative way of looking at food, alternative to the way that, I can't remember how much money is spent on advertising processed foods every year, but billions of dollars. And yet there's very little money spent on promoting real food, whole foods as you're calling them. How best is that message propagated? What's happening to help people understand this now?
That's a wonderful question, and I think I can't give you the answer to that, but I can tell you that from my perspective, I would like for the medical system to get on board in giving that message, because I think that, in fact, not just physicians, but the entire institution of healthcare in this country actually carries a lot of weight. And by equating that kind of diet, and I try and move the conversation not just from eating, but from our whole system to our whole system of food production, because that's really what predicts the way that we eat. So the way we're growing our food, the way we're processing our food or not processing it, the way we're marketing it, where it's being sold, I think that that is something that healthcare has a role in, it has a place in the conversation and needs to come out very strongly, talking about an alternative way of growing food and eating. And so far, that's only happened in very small ways. There's a coalition called Healthcare Without Harm, and they are actually getting hospitals to sign pledges to buy a certain amount of produce from local farmers. That's one example that I've seen. Preston Maring's effort through Kaiser, which has now really taken hold to have farmers markets in the parking lots of clinical facilities, is another example. You know, it sort of gives the message. Certainly starting to get healthcare to sign on to all the policies that determine the quality of our food, from, you know, whether antibiotics should be allowed in animal production, to how chemicals should or should not be used in the soil, to what is the role of genetic modification in food production. We need that voice there, and that's probably even more important than, you know, teaching individuals how to eat.
Right. You're speaking about, I mean, I hear you speaking about doctors, practitioners as scientists, really, as analyzing what ought to happen with food and agriculture, but we really don't see a lot of that. But you're saying we're seeing more.
We're seeing more, but it needs to happen a lot more. And where the gaps are, honestly, Mark, is that both in political, financial and academic circles, there's not a lot of conversation between these two groups. I mean, you have the medical industrial complex and then sort of the food industrial complex, and they don't really talk to each other. Ironically, a lot of the pharmaceuticals that are being sold to both of them are from the same companies, like Syngenta and Bayer and what have you. But they certainly don't talk to each other in terms of, you know, really looking at, when you look at return on investment in business, you don't, you know, take the cost, for example, when you're looking at the production of corn, you don't take the cost of diabetes that high fructose corn syrup that corn is going to cause, and put that into the equation when you look at ROI on the corn, if that makes sense. So, you know, we're treating all of the medical costs on this junk food that we're producing as externalities, not internal to the equation. And then in academia, you don't have the scientists that are working on human health speaking with the scientists who are working on soil health and environmental health. And so we're not doing a lot of that same transdisciplinary work in that area either. We're not really understanding how health marches out from soil to human. You know, we sort of stop midway and then hand it over to the human scientists. And the same thing happens in politics. The people who are really involved in making policies around human health rarely pay attention to what's going on in environmental health and so on.
So, but in each of these disciplines, in agriculture, in medicine, in politics, you have what you're calling, for example, the medical industrial complex or the agriculture industrial complex, whatever. You have a dominant group that's interested in the status quo, and you have a minority group, at least in my opinion, that's interested in seeing things change for the better.
Absolutely. I think that the challenge, and you know, I prefer not to think of it as as the self-interested dominant group. I prefer to think of it as a communication problem, in that, in fact, if we really were able to start to have conversations across sectors, then the folks who think that they're so self-interested within food production or health or whatever would start to actually see things differently. I mean, if the equation really were to start to shift and they could see how these other variables play in. There's a whole group now that are really trying to do, ecosystem valuation and landscape analysis and really understand how should you do urban planning to make it the most cost effective. And they're realizing that, in fact, they do need to take in all these variables. They do need to look at how we're treating the soil and what that means for human health and so on. Because it's, at the end of the day, it's one big budget for this country, But it's just that we haven't been able to communicate and think in this complexity way. So, I guess maybe I'm framing it this way so that there's a hope for change, but my goal is to get these sectors to really start to talk creatively to each other and really start to ask, come up with a common language and really start to ask questions that straddle these different disciplines.
Is there I have two more questions. Is there a direct link between soil health and human health, or if there is, can you explain that to me?
Well, absolutely. I mean, probably one of the most obvious links, and I'm going to talk about it in the talk tonight, is that when you have an alive, vibrant soil that's very microbially rich and microbially diverse, then what all those microbes are doing is actually extracting nutrients from the soil and passing it on to the food. They're these great go-betweens. And it turns out that microbes aren't all created equal, and certain of them are better at extracting certain nutrients from the soil and passing them on to specific plants in kind of a lock and key fashion. So you need a whole diversity of microbes in order to get the most bang for your buck in terms of nutrition. But that's only one direct link. We also know that microbes in the soil actually probably play a role in our own microbiome and how our gut operates. And in fact, they've found microbes that traditionally have existed on plants and are really successful at extracting nutrients from plants, and that probably over generations have migrated into the guts of folks who are in that ecosystem and have helped them extract nutrients from these same plants. So there's this kind of gene swapping that goes on all the time between us and our soil. And if the soil is healthy, the messages tend to be very positive ones. But there is some research to show that if it's soil that's been treated with antibiotics and pesticides, then in fact what you're doing is producing microbes that are antibiotic resistant and pesticide resistant, and that those then send those dysfunctional messages into our gut. So that's another example. I can give you many more, but then on a sort of broader sort of atmospheric or ecosystem level, if soil that's mistreated, that's kept in monoculture, that's been drained of all its nutrients, tends to create a lot more runoff. You actually lose the soil, you lose the carbon from the soil into the atmosphere, which creates greenhouse gases, which are also very bad for our health. It doesn't act as well as a water reservoir, and so you actually lose your water tables. And as you know, as a planet, we're really losing a lot of our potable water reserves as a result of our mistreatment of, one of the reasons is our mistreatment of soil. So, the examples sort of go on and on. Soil that has pesticides in it, that's more likely to wash into the water and actually create polluted water and so on.
Good. I'm glad I asked that. All right. I'm sorry I didn't ask this before, but let me ask it now.
Yeah.
Is there a way in which the Affordable Care Act can help people eat better? Because I know there are some provisions in ACA for community money, for preventive health, for things like that. Is there a way that it can be used and should be used that we're not seeing the results of yet?
Absolutely. I mean, I think that first of all, there's actually wording in there specifically about dollars that can be used for food purchasing, like the WIC money and food benefits, and how those have actually expanded more to enable people to use them, at farmers markets and for unprocessed food and so on. But I actually am not familiar with a lot of the fine language, the fine wording in that. But what interests me a lot more is this community benefits allocation that's in the Affordable Care Act, and the fact that 3% of the profit for for-profit medical institutions and hospitals has to be spent on what is now called population health. And that's a very broad idea that somehow we should be spending our healthcare dollars upstream far before people get sick, and not within the purview of the actual medical institution, but on the population at large. And when you start to think of one of the best places to spend preventive money, and we call this primary prevention, which is different than mammograms or things that are there to detect disease at an early phase. Primary prevention is before you get sick at all. One of the best places to spend that is on our food system. On everything from food hubs to supporting healthy agriculture, to getting great food into schools and other institutions, to creating coalitions of farmers to be able to supply a whole community. This is actually very exciting that for the first time we have these dollars, healthcare dollars, because healthcare is deep pockets, right? That are allocated for community health, and that hopefully a lot of that will be spent on our food system. And housing, and fair wages, and green space, and all these other things too. But food is an important part of it.
Great. Thank you, Daphne.
It was a pleasure, Mark.
I'm Mark Bittman for Edible Education 101. I've been speaking with Dr. Daphne Miller, who's on the faculty at the University of California, San Francisco.